Close-Up is brought to you by the Kia Sorento R, redefining the power of Kia.
Dr Lance O'Sullivan has decided to give the health system a miss. He doesn't want to give his patients a miss. In fact, they think he's a miracle worker. But the system, he says, is getting in the way. So Dr Lance resigned. And his patients took to the streets in protest at the system, not at Dr Lance. So does the doctor need some treatment himself? Jill Higgins in Kaitaia.
I'm going to have a listen to your heart, so I'm just going to open up your shirt. Can you poke your tongue out? Wow.
There is something about this doctor that strikes a chord with patients.
We'll pop a little drip in somewhere.
It's partly his bedside manner, you know, but also he's a strong advocate for social justice.
You're not a number to him, you're a person.
What about a walking frame? Has he ever had a walking frame?
He's the only Māori doctor in our area. From our point of view, he's a treasure. He's got an understanding, he's got an ability that nobody else has.
I'm just going to check his breathing.
He knows it and he flaunts it.
It's a skill I have, and I think I'm lucky I have it. I went to medical school to help people, and I can truly say that every day I go to work, that's the thing that's getting me up in the morning. He is still hot.
He's still applying that skill in hospital, but until a week ago, he was also putting it to good use as a very popular GP.
So why resign?
I struggle working in a health system where I've been seeing patients that really need healthcare and can't get it because of financial barriers. So, you know, my resignation is looking at seeing how I can change that.
His former employer, the local Maori health provider, says he didn't need to resign.
The impression that we turned away patients because of non-payment is, we'd challenge that. If there are any difficulties, I'm sure that the mechanisms are in place to deal with those.
But here in Kaitaia, with its high rates of deprivation, it's all about how they're dealt with. There's the bureaucratic route.
There would be attempts by our staff to investigate the avenues whereby some funding could be made available, for example, through some of the government agencies.
How many other little ones below my time?
Or there's Dr O'Sullivan's approach, which is more personal.
I treat my patients in the clinic, I treat them after hours, I go to their homes, I treat them in the supermarket, at the rugby fields. I treat them when they need it.
The trouble is, it breaks the rules.
I was reprimanded for treating patients that didn't have the money to pay. It did not sit comfortably with me. We're not accountants, we are doctors, and I struggle with the fact that I need to check how many coins a person's got in their pocket before I can give them the treatment they deserve.
Even though he has his own sizable whānau at home, it gets his wife's backing.
He often rings patients, he often gives his phone number to patients. I don't have a problem with it at all, really. No, I mean, I think it's great. I think it's what they used to do in the old days, isn't it?
He's more from the heart, Lance.
Ruby is very glad he's the way he is.
We randomly met him at a dance festival. My son was standing at the back and I use a mask to protect my son from catching germs. And Lance just randomly come up and asked what's wrong with my son and that he's willing to help us. And
her son has breathing difficulties caused by growths in the throat. Every third week he goes to Starship, often for surgery. But Dr O'Sullivan saw there were more issues.
So how did Lance help you?
He helps us with insulation in the property, more medical equipment that he needs, medical prescriptions.
We struggle with the fact that a lot of the issues our patients are presenting to us with are due to things beyond our control. Poor housing, nutrition. We have to make a comment. I think it's our obligation to do so.
He's done so in the past. This, a programme we did on rheumatic fever.
Rheumatic fever is a disease of brown little faces. You don't see it in white children.
Can you do me a favour and say ah?
But some comments have raised concern, his former employer saying he could speak out, but not on their behalf.
I make no apology with the fact that my advocacy could push me into the realm of being challenging.
Now out on his own, it will be easier.
Kia ora, Peter.
Tēnā koe, brother.
One of his new ideas is to help young men avoid ending up like this.
Had a heart attack, and for a 40-year-old man, it's really quite a significant thing. The things that would have contributed to it are things like, you know, smoking and blood pressure problems.
You think this is one of the problems, that there's too much emphasis at this end?
It's like having a house with 10 fire extinguishers and 1 smoke alarm. We just, you know, we're not getting in there early enough.
The things that he has been saying, we all agree with, and that's why he's such a popular guy.
You want to give me 5? Ooh.